Hello and welcome to beautiful and hot Las Vegas for HFMA's annual conference. I'm sitting here with Mike Morris, CEO of Xtend Healthcare.
Yeah, thank you. I appreciate it, and I can confirm it is indeed hot outside.
There you go. So today we're going to be talking about challenges.
Yeah.
What are some of the more recent revenue cycle challenges that Xtend's customers are experiencing?
Yeah, so Xtend Healthcare serves a variety of providers across the United States, and we hear common themes when we talk to our customers. And number one's probably not a surprise to you or anyone, and that is denials are a big challenge across the industry. Even the best run revenue cycles are seeing a spike in the number of denials that they have. And interestingly, it's not necessarily an increase in fatal denials or those things that you can't overturn. It's the denials that slow things down and gum up the works that are happening at a higher rate than we typically see. And it's things that typically aren't being impacted by what the provider is doing or not doing. So they're filing the claims, we believe, correctly, and they're just denying at a higher level than before, which creates a lot of downstream stress on cash flow and the cost to collect for our customers. So we see that as a challenge. You know, interestingly, also RAC audits have been around for a while, but there was a pause during the pandemic, and we're seeing a lot more of those going on. And again, it's just a resource constraint to be able to adequately respond to RAC audit requests, and our customers are stressed by that. And then finally, I'd say it's managing revenue cycle differently today than we ever have before. For people that have been in the industry for a while, you have to manage a workforce differently. You have to move work events that used to be done manually into an automated fashion, and you've got to do that with a distributed team that's not all in one spot. So just having the right resources and the right mix of people and technology is something that I think is a big challenge for all providers and health systems out there.
Right. So for these health systems facing all these challenges, what should they be doing, especially related to denials?
Yeah. So I think it's all about staying coordinated, having skills-based routing and automation in place that helps you identify the trends in your denials early on and being able to move the appropriate claims that have like-kind denial reasons through a workflow process that's efficient to be able to overturn it. The other thing you obviously need to do is you need to address the issues in either the front or the middle of the revenue cycle where a lot of the root cause reasons for denials are taking place. It's course correcting in those areas where you need to in order to be able to efficiently prevent future denials. So it's denial management and denial prevention simultaneously.
What role does technology, AI for example, play in solving these challenges?
Yeah, huge role. I mean, and everybody's got a different take on how to leverage technology. The EHR platforms are better than they ever have been, but supplementing those with tools and technology to become more efficient oftentimes is the best strategy for a health system. So we work with a lot of our customers to identify how you can best mix that technology. But as much as a lot of the product companies would like to think so, I don't know that technology will ever displace people in the revenue cycle process. It's still a people-intensive process that you go through that is aided and enhanced by the technology, but it doesn't displace those people. So getting the right mix of people, process, and technology is super important.
What ways can hospitals combat declining reimbursement and margin erosion?
Yeah. It's by staying on top of it, you know, and that's everybody we talk to, every one of our customers, their big challenge is, how do I get all of this work done? How do I communicate with my payers in a fashion that allows them to understand what they're doing that's causing denials of claims that shouldn't be denied? And then ultimately, how are you keeping your staff motivated to stay focused in a time where it's demoralizing to have to go back and rework a claim that you know was worked correctly? And for clinical denials, it's demoralizing to your clinical staff to have to spend time trying to address those things. So at Xtend, we're trying to help our customers combat all those things and provide the resources to get through those challenges.
So for revenue cycle management organizations such as Xtend, how do they help make the job of collecting money for hospitals easier, more cost efficient?
Yeah, so Every health system out there has a mission statement, and no mission statement has anything to do with revenue cycles. So, providers do a very valuable thing in our country, and that is they take good care of patients. We believe that companies such as Xtend could come in and handle the financial and the cash flow aspects of getting paid appropriately for those clinical services that are rendered in a manner that allows that hospital or health system to be able to focus on their patients. So we feel that's a super important role that vendors such as Xtend can play to help do things more efficiently than typically can be done in-house by a rev cycle team.
Thank you for taking a little bit of time to talk.
Absolutely. Thank you for hosting, and we look forward to the remainder of the event.
All right.